Hello doctors, students of homeopathy and friends of homeopathy. Today is the 1830th day of uninterrupted daily webinar of IFPH. And today our guest is Dr. Dhanalakshmi R. Mallan from Alappuzha, Kerala. After her homeopathy graduation, she got diploma in clinical psychology. She is the consultant physician at Dr. Mallan Homeo Clinic, Cherthala, Alappuzha. And she is the daughter of famous homeopath Dr. A.R. Mallan, retired DMO, Alappuzha. She worked as lecturer and residential medical officer at RVS Homeopathic Medical College, Coimbatore. And she do have more than 15 years of clinical experience. And today our topic of presentation is breastfeeding and homeopathy. Let's welcome Dr. Dhanalakshmi R. Mallan, and I welcome you all for the session.
Thank you, Doctor, and good evening all. So, according to UNICEF, around 8,20,000 lives can be saved every year globally if breastfeeding practices were promoted adequately. More than 20,000 maternal deaths due to breast cancer could be prevented each year through breastfeeding. Yet, only 44% of infants are exclusively breastfed during their initial months. 1 in 3 women do not receive adequate support for breastfeeding after birth. And in low-income countries, every 1 out of 2 infant is not breastfed within the first hour of life, missing out on critical antibodies that can protect against deadly diseases. These are not just statistics. Every number represents a baby, a mother, a family in pain. That too, when we have the solution in our hands. So Breastfeeding Week is celebrated every year worldwide. And this year, 2025, the theme is Invest in Breastfeeding, Invest in Future. This is a global theme, and national theme is Prioritize Breastfeeding, Create a Sustainable Support System. Breastfeeding is a human right. Breast milk is the first vaccine, the first protection, the first food that the baby receives. It's nature's perfect planned food for the baby. It provides ideal nutrition, changing in composition as the baby grows. It contains antibodies that protect against pneumonia, diarrhea, infections, and long-term risk factors like obesity, asthma, diabetes, heart diseases, etc. It also promotes healthy brain development and development of cognitive skills. More than that, breastfeeding is a time of emotional bonding between the mother and the baby. So what are the barriers? What is stopping a mother from feeding her child if breastfeeding is so important? So the first barrier would be a lack of support and guidance. Many mothers don't get timely help from healthcare providers, family or lactation counselors when challenges arise. And workplace and time pressure adds up on it. When mothers are expected to join back to their workforce, they don't have time or facilities or pumping facilities, private areas or breaks to visit their child to breastfeed. There are many cultural beliefs and myths which misguide the mothers and stop them from breastfeeding the child continuously. Then aggressive formula marketing. So there was a time where the media was bombarded with advertisements promoting formulas as a healthier and modern and convenient option. The medical and physical challenges are to be considered, and we'll discuss it in our following slides. There are also social barriers to breastfeeding. We live in a society, still in 2025, we live in a society where a mother is made to feel ashamed of nourishing her child, especially in public. There are people who criticize or stare or snicker on a mother who is breastfeeding her child in public. She's even expected to stop breastfeeding or go to a different place just because it makes some people uncomfortable. The price of this not breastfeeding a child, is very high. It creates a generation, it creates babies with inadequate weight gain, weak immunity, poor sleep, excessive crying, delayed developmental milestones, less bonding with mother, and long-term risk factors like 15% higher risk of deaths from asthma, 11% higher risk from development of diarrhea, higher risk of diabetes, obesity, and asthma, increased risk of childhood leukemia, and greater chance of sudden infant death syndrome. So it is a win-win situation for both mother and baby. So what does a mother gain from breastfeeding? She gains back her health, faster recovery, the uterus, the hormones which are secreted during breastfeeding enhances the regression of uterus to the previous to the size previous to the pregnancy. The calories that get burned during breastfeeding promote and help in weight management of the mothers. It also helps a mother reduce risk factors like breast cancer, ovarian cancer, type 2 diabetes, and high blood pressure. So breastfeed is the nature's secret recipe. So every time, as the baby grows, the composition of breast milk also changes. So a mother's body knows innately, intuitively what the baby needs. So breastfeed should be initiated. It is very important to initiate breastfeed within the first hour of birth. And the first milk is called colostrum. It is also called liquid gold because it contains a lot of antibodies, proteins, and fat that prevent deadly diseases in a baby. So what should be the frequency? When should be a baby breastfed? Ideally, it is one breastfeed can last up to 15 to 45 minutes, depending on the baby's appetite. And this can be done. Baby can be fed every 1.5 to 3 hours, which is around 8 to 12 times a day, of course, as on demand of the baby. We have to observe the baby for signs of hunger, increased alertness, rooting. What is rooting? Rooting is when you touch the baby somewhere around the face, the baby turns its mouth towards the place it is touched. So that is called rooting. And mouthing is when babies tend to start chewing their arms or anything available to them, and that is called mouthing. So these are the initial cues of hunger. It is always ideal to start feeding the child when you get the initial cues rather than waiting for the baby to cry, which is a late sign of hunger. And breastfeeding is the ultimate room service for the baby. So every time the baby demands for milk, you have to offer breast milk. And proper latch is important. What is latch? It is the tight grip that the baby's mouth has over the nipple or areola of the breast. So the whole areola portion, the darker portion of the nipple has to be inside baby's mouth for proper suckling to happen, and that is called latch. So a mother has to be educated about a latch. And milk ejection is not a mechanical process. Baby is not drawing out milk as happens in a bottled milk. Okay, it is not a mechanical process, but it is a response to a hormonal it is a hormonal process in response to the suckling of the baby. So as the baby suckles, prolactin and oxytocin coordinate for the release of milk from the mother's breast. So this milk is released only on demand of the baby. The more the baby consumes milk, more the milk supply happens. Something has to be understood here about foremilk and hindmilk. Foremilk, as the name suggests, comes first and hindmilk comes later. So we can observe when we refrigerate fresh milk, after some time, after a few hours, we can see that the fatty portion of the milk has been accumulated on the top layer of the vessel. So something similar happens here in breast milk as well. The dense and fatty portion remains at the back of the breast. So initial foremilk, which contains more water, has to be expressed out completely for the hind milk to be expressed. So foremilk is the thin, watery, somewhat bluish white colored milk that comes initially. It is high in lactose, water, vitamins, and low in fat. So this portion is the one that quenches the baby's thirst, and this gives energy to the baby. Whereas hind milk is thicker, creamier, and more yellowish, higher in fat and calories, keeps baby full and satisfied. And this quenches the hunger of the baby and helps in weight gain and proper development of the baby. So we have to ensure both the baby gets foremilk and as well as hind milk. So how can we ensure that? We have to ensure one breast is emptied completely before the other breast is offered. So let the baby finish one side. How do we understand one breast is emptied properly? The baby may get bored or take frequent breaks as if it's not getting anything from the breast. And the breast feels softer. So at this stage, if you still feel the baby is hungry and wants more, you can offer the other breast. Then positioning of the baby for breastfeeding is also something very important. We have to ensure that head, neck, and spine of the baby is straight while breastfeeding. So whatever position you hold, the baby's neck, head, and spine has to be in a straight. It should not be turned. The neck of the baby should not be turned. Imagine us eating food while turning our head sideways. It's not comfortable. It's same for the baby. So the baby's neck should not be turned sideways. Tummy to tummy contact has to be there. Mother's tummy has to come in contact with the baby's tummy. That would be the ideal position, so that the whole body turns towards the mother while breastfeeding. Baby's nose should be near the nipple. Okay, while holding the baby, make sure the nose of the baby is at the tip of the nipple, so that while reaching for the milk, it reaches above and holds the whole areola of the nipple in its mouth, and latching happens properly. And while holding the baby, we have to make sure the position has to be proper, and breast should not come to the baby, but baby should be brought to the breast. Use pillows for support if needed. And these are a few positions for breastfeeding: laid back nursing position, cross cradle hold, football hold, and side lying position. So these are only a few positions suggested, most popular ones, and the football hold and side lying position are ideally suggested for cesarean section delivery. Then, how do you satisfy a baby? How do you understand that a baby is satisfied? So you gave you held the position, held the baby properly. You're breastfeeding frequently in the correct frequency at the correct duration. You are giving hind milk and fore milk. When do you understand a baby is satisfied and it is sufficiently getting milk? So the first sign is, as the photo suggests, the baby is happy, calm, and sleeping, dozing off while breastfeeding. So this is the first suggestion. And also the objective signs are more than 6 pees a day and more than 4 poos a day. Weight may dip slightly after birth for a week or so, but after 10 to 14 days, it regains, and steady weight gain happens thereafter. So these are the suggestions that the baby is satisfied and is getting sufficient milk. What are the warning signs of low intake? Weak cry. The baby does not have the energy, development is not proper, the urine and bowel movements are low, stools are hard and not as frequent, low weight gain, or persistent jaundice. These are the warning signs when the baby has to be taken for immediate care. Then some additional tips are: burp the baby after feeding. Burping by itself can be considered an art. You can imagine an air bubble trapped inside a straw or a plastic tube. So what would happen? You would turn the straw accordingly so that the air bubble comes towards the opening. So we know the air always moves towards the top due to the density difference. So if there is a larger bubble, the bubble has much difficulty to come out because it has to overpower the weight of water above it. So same happens for a baby. First of all, how does air enter the baby's tummy? Air enters every time the baby breastfeeds or gulps milk. So with every gulp, baby swallows a bit of air inside. So we have to make sure we are holding the baby, frequently manuring the baby so that the air can come out easily. If the air gets accumulated in the tummy, it can cause gastric troubles and colics. So make sure every time the baby is burped, just by tapping the back of the baby doesn't work. You have to maneuver the baby, give a few movements, and then tap the baby for easy burping. Then, how long should a baby be breastfed? Ideally, it is said for the initial 6 months, exclusive breastfeeding should be done. No water, no semi-solid foods, nothing else than breast milk. And it can last up to 2 years or beyond. It is the choice of the mother. Then avoid formula or pacifiers early unless medically necessary to avoid nipple confusion. What is nipple confusion? Bottle or pacifiers are something very easy to be chewed, and for the baby, milk comes out easily from the bottle than from the nipple of the mother. So it can cause a nipple confusion. It is ideal to avoid formulas. Then mother should be using loose, soft, and breathable fabric clothing. And what a mother should take care of is her hygiene, sleep, exercise, hydration, diet, and to stay joyful. And keeping a mother joyful is not just her responsibility, but for the whole house is responsible for taking care of the mother. And how should be the diet of the mother? It should be rich in protein, calcium, iron, and healthy fats. Our mother is always hungry. She's burning a lot of calories. So it has to be taken care of. What the mother feeds on is what reaches the baby. So mother has to be careful, avoid excessive caffeine or spicy food, stay healthy, eat healthy. And another field where mothers need support is when they join back for work. So, Indian government has implemented many policies and offered many benefits for working mothers, like 26 weeks of maternity leave for mothers, and the act that establishes employers should provide crèche facilities and breastfeeding facilities for companies who are having 30 women or more than 50 employees. So mothers should have access to visit the creches frequently. Mothers should have access for pumping their breast milk or feeding their babies adequately. Then regarding pumping, a mother should start planning before 2 weeks. She's planning to go for work. So, pumping is not going to be easy, but with perfect planning and execution, it can be done and it is possible. So, pumping has to be done at the same time the baby would nurse. So, every pumped milk has to be stored with a label of time, date and time on it, and it has to be used on first come first serve basis. And the breast milk can be ideally stored. It's a 4-4-4 rule. Room temperature approximately 4 hours, in the fridge approximately 4 days, and in the freezer approximately 4 months. Then, what are the other supportive systems provided for breastfeeding mothers? There are lactation management units, hospital-based support, baby-friendly hospital initiatives. So, these are hospital-based supports wherein hospitals are required to support the mothers regarding a lactation process and taking care of the baby and overcoming challenges. Then Anganwadi centers and ICDS networks are providing awareness to mothers regarding nutrition and breastfeeding processes. There is a Mother Absolute Affection campaign going on. It is a social campaign at a larger scale for breastfeeding awareness, and there are bottled milk-free health centers to promote breastfeeding. Internationally, there are La Leche League, which is a support group for breastfeeding mothers, intensively going on in international level to promote and support breastfeeding mothers. Then, breastfeeding support for Indian mothers and breastfeeding promotion network of India are some social platform networks, and ALPI or Association for Lactational Professionals India is a website where you can get lactation professionals. You can get certifications, also access to professionals for guidance regarding lactation. Then Pradhan Mantri Madhura Vandana Yojana and Janani Suraksha Yojanas are some schemes that provide financial support to mothers. A mother can avail up to 6,000 rupees for every childbirth. And what are the challenges in breastfeeding? Breastfeeding is natural, but not always easy. A mother needs support in every stage of breastfeeding. The challenges can be physical, emotional, or social. So, for physical, homeopathy is something that can offer support in all these three levels. As everyone is aware, homeopathy provides holistic treatment. So it listens to the mother's emotional and physical judgment and provides solutions and medicines for the same. And it is also up to a homeopath to offer reassurance and confidence building advice to overcome fear, guilt, or self doubt regarding breastfeeding. We also need to promote exclusive breastfeeding by educating families against early introduction of animal milk, artificial supplements, or unnecessary medications. So I think homeopathy is the only system which can provide emotional support through medicines. And some areas where a mother may need emotional support is postpartum anxiety, insecurity, fear, exhaustion. So delivery is a long and tedious process for a mother, especially for the first delivery. It is usually a long process. Mother gets exhausted mentally and physically, and it may cause anxiety, insecurities. She doesn't know how to handle the baby. She doesn't know how to handle herself, and it is a very difficult situation. She can go to depression or emotional detachment stage. So sepia is a magical remedy which can help at this stage where a mother can show irritability, detachment. The state is called mom burnout. So she's indifferent to the baby, sometimes doesn't even want to look at the baby. So Ignatia is a result of more of emotional trauma. She's very sad, upset, and with mood swings. Pulsatilla, as we know, is predominant in its weepiness and clinginess, always wants to hold hands, always wants to be touched, and seeks comfort all the time. And lac humanum is when is for healing unresolved mother-child issues. So one of the major physical challenge a mother faces is low milk production, insufficient milk production. There is a lot of pressure from the family asking mothers to start formula feeding at this stage. So she is she is having self-doubt. Is my milk sufficient for the baby? Is my baby undernourished? So the secret ingredient for this, secret remedy for this is hydration. Mother has to drink a lot of water so that milk is produced. And we have to understand that demand is equal to supply. If your baby demands more, supply will be more by itself. You need not do anything. Rely on yourself. Have confidence that your body will produce sufficient milk for your baby. Still, there are homeopathic remedies which can help enhance natural breast milk. Some of them are lactica virosa, which increases milk flow in nervous or exhausted mothers, Ricinus communis tincture, effective in complete absence of milk, and Gallia officinalis when delayed or absent milk in undernourished weak mothers, and alfalfa tincture improves appetite, vitality, and overall milk quality and overall health in a feeding mother. So coconut water, daily consumption of tender coconut water can be magical. Another physical hurdle can be engorgement of breast or oversupply of breast. So it takes around 2 to 4 weeks for a breast milk to get regularized according to the demand of the baby. So this can be a challenging period that with proper guidance, a mother can overcome this period. So this engorgement is a state where the breast feels very full, sometimes painfully full, and sometimes the baby is not able to latch properly onto an engorged breast. So what can be done? 2 minutes ahead of breastfeeding your baby, massage can be done. Hot presses can be provided. So with proper massage, you are softening the breast, and some of the milk, some of the fore milk can be expressed out so that the breast becomes softer. And there are remedies, homeopathic remedies for this condition. Some of them are belladonna, for sudden swelling, redness, heat, high fever may accompany. Bryonia, rock hard breast, hot with stitching pain on least movement. Phytolacca for overproduction with pain, hard lumps, feels hard and tender. Pain radiates from nipple to the whole body. Urtica urens with stitching, burning pain, feels heavy and tense. So there are other remedies like lacananum, pulsatilla nigricans, calcarea card that can help. So according to homeopathy, the remedy is often individualized. So you don't have medicine for a particular condition but only for a particular person or a patient. So just because you have engorgement, you can't prescribe belladonna. You have to look the individualization of the patient, the thirst, the thermal regulations, the personality of the patient, and then you come to the conclusion of the remedy. Another condition can be mastitis. So mastitis is also a painful condition, but unlike engorgement of breast, it can be a localized pain. So one lobe of the one lacule or one lobe of it can be infected and cause redness and pain of breast. So this is a condition which requires medicine. Belladonna can help, which has sudden intense inflammation. Hepacel for abscess pus formation stages. The patient is usually chilly. And Silesia for chronic recurrent mastitis, where healing is slow. And Bryonia for systemic symptoms with breast hardness. And cracked nipples is yet another condition, but this is usually due to baby not latching properly. When the baby feeds on the tip of the nipple, not taking the whole areola into its mouth, it can mostly lead to a cracked nipple. Then some of the remedies for this is graphitis with deep, painful crack, sticky honey-like discharge, unhealthy skin. And castor equi, raw ulcerated nipples, pain extend from nipples to chest or back. Calendula tincture promotes rapid healing of cracked nipples. And painful phytolaga with painful cracks with nursing pain, sensitive, inflamed, and sore. Pain radiates from nipples. Nipples should be allowed to air dry after feeding. So if the pain is severe, crack is severe, make sure you wipe the nipples with a wet cloth after feeding and then with a dry cloth to ensure proper drying. So support for babies feeding issues. When the baby's suckling is poor or latch is poor, this can mostly happen after an epidural delivery. Epidural is something, an injection that is given on the spine of the mother to reduce the pain during delivery. So some of the kids can face this issue, poor latching, and the baby doesn't hold the whole areola in its mouth. Some of the remedies can be calcarea card, where the baby is chubby, sluggish, and with delayed milestones and weak muscle tone. Babies who are physically weak take forever to nurse and sweat a lot around the head. China or Syncona after excessive fluid loss, maybe after diarrhea or fever, and baby becomes weak and suckling reduces. Baby refusing to feed or aversion to milk. Don't want it, won't take it, you can't make me eat. So baby is adamant that it won't breastfeed. It can be due to colic or some physical conditions, and the baby can be hangry. Okay, he's hungry but doesn't want to feed. Some of the remedies are chamomilla, especially during teething, and colicky angry baby who screams and rejects feeds is always irritable. And Naxomica, oversensitive, easily irritable babies may also regurgitate milk often. Lycopodium, gassy, bloated babies who are hungry but turns away after a few sucks. And vomiting and feeding or regurgitation. Milk comes out faster than it went in. Rule out pathological causes. There can be pathological causes like pyloric stenosis that can cause projectile vomiting and frequent regurgitations. Those conditions has to be ruled out. And some of the remedies for this condition can be Ethusa synapium, classic for babies who vomit curdled milk soon after feeding and become weak or drowsy, cannot digest mother's milk. And Antim crude, overfeeding, or when digestion is sluggish, white coated tongue, vomiting mixed with mucus. Silesia for vomiting soon after feeding, babies refused breast or be too weak to suck and constipated. Calcarea fos for babies with slow digestion, poor assimilation, and frequent spit outs. Colic during or after feeding. This is also a condition where baby refuses to feed. It is hungry but cries after every feed. Colocent pulls up legs relieved by pressure or warm compressors. Macphos, great for spasmodic pain, better in warmth and rubbing. Chamomilla, of course, baby wants to be carried, and red, irritable and inconsolable baby. Delayed digestion or failure to thrive. Milk goes in, but growth isn't showing up. So baby is consuming milk, not regurgitating, not vomiting out, but still it's not gaining weight. Calcarea force were thin, irritable babies with big appetite but poor growth. Silesia doesn't absorb nutrients properly, slow gain, frequent illness. Natromore, where the babies are thin with large head and craving for salt. And tuberculinum, recurrent infections, weak immune system, restlessness. Thrust or oral candida is a fungal infection where white patches in the mouth and the baby is cranky while feeding. Borax, where the mouth is sensitive, babies cry before feeding due to pain, patches in mouth that bleed on touch. Merck salt, offensive breath, excessive drooling, ulcerated mouth, tongue with imprint of teeth. And calichloricum for raw, painful mouth with burning sensations, dirty white or yellow tongue. And sulfur for recurrent thrust, slow response to remedies. Here is a condition where not only the baby but mother also requires treatment. And homeopathy is a condition where the mother and baby can be treated as a single unit, and medicine can be given to the mother so that it reaches the baby through breast milk. And there are also conditions where babies has to be given medicines directly. So after all the challenges for breastfeeding, weaning is also an important stage where mothers and babies may need support. So weaning is when solid or semi-solid or other food particles are started on babies. So weaning can cause physical discomfort, engorgement or digestive shifts, emotional distress, clinginess or mood swings for both, and sleep disturbances. So weaning can be done after stopping of breast milk or along with breast milk. Weaning can be done at 6 months of age. And for distress for mothers during weaning, ignatia for sadness, suppressed grief, sighing, laconinum for alternating breast pain, fear of letting go, and pulsatilla feels abandoned, milk is slow to reduce, and urtica urens tincture helps dry up milk naturally. Phytolacca, lumpy glands, hard, painful breast, and natromore for suppressed emotions, dryness, silent sorrow. And for weaning babies, pulsatilla, when the babies cry, they are clingy and wants constant cuddles during the transition. Chamomilla, irritable, angry baby who throws tantrums, great when teething overlaps with weaning. Ignatia, babies appear sad, emotional, sensitive to change. Aethusa synapium vomits curdled milk or has indigestion with new foods. Calcarea cup, sensitive tummy, bloated, slow digestion with fatty foods, and silesia for poor assimilation of nutrients, slow growth despite good appetite. Coffea cruda, overexcited baby, can't settle to sleep. So as homeopaths, what we have a larger role. Homeopathy can play surprisingly a meaningful role in promoting and supporting breastfeeding, not as a replacement for medical or nutritional advice, but a gentle guide and a friend to mothers. And homeopathy can support emotionally with physical remedies. It can provide guidance and encouragement for breastfeeding. It can integrate with other community centers or health centers for the development of mothers. And it has an holistic approach. It sees mother and child as a unit and treats accordingly. So homeopat's role is just not about remedies, it's about being a compassionate supporter and educator who helps mothers overcome doubts and difficulties when reinforcing breastfeeding as a natural and healthy norm. So it is an immense power of homeopathy we hold, and we need to use it for the development of a better generation and a better future. Thank you.
Excellent presentation. Thank you, Doctor, for the session. And a very power-packed, very informative session.
Thank you.
Nutrition and protective purposes for the child and for the mother's health. Both together, breastfeeding is giving a lot of things, and the wide medicinal armamentarium we are having in homeopathy is the other boon which other systems are not having. So for a galactic one or two medicines or some interferences only can be happen with other systems, while homeopathy have a lot of things. And Doctor pointed out a lot of things, and it's the time to communicate with the speaker. Let me welcome to interact with the speaker. Dr. Sridhara Kurup. Let me unmute him. Sir, please.
Whether it is audible?
Yes, sir.
It is audible. Yes. Dr. Dhanalakshmi, it was a very nice, excellent presentation. Thank you very much. Your this PPT was also very good. Thank you very much. So your father is my classmate and intimate friend. So I was listening very carefully. He was very good in the in studies also when he was a student. So I am so happy that you are also coming the same way. Thank you very much. Keep it up. Wish you all the best.
Thank you, Doctor. Thank you.
Thank you, Doctor. And 15 more minutes to go, and we can interact. So, Doctor, you mentioned about the interval, the time, which a lot of persons, a lot of mothers are always in confusion that how many times the child should be fed. And you mentioned about that also. About 15-45 minutes each breast we need to give breastfeeds and to be breastfed. And we can make it at an interval of 1.5 to 3 hours, isn't it, Doctor?
Yes, Doctor. And there can be a confusion. Should a baby be woken up while in between sleep to be breastfed? It is yes. The answer can be yes and no. Means you need not be panicked if the baby is not waking up, but you can breastfeed the child in its sleep. It's called dream feeding, so that it can continue its sleep and also be fed properly. And also there can be confusion regarding twins. Is the mother's milk sufficient to feed both the babies? Of course, it is sufficient. As we said, demand is equal to supply. As the demand increases, supply also increases. Researchers prove that a mother can secrete around 1 liter excess milk for twin babies. So there is not always a necessity to provide formula milk in case of twins or multiple pregnancies. At least for twins, you don't require formula feeding. And I think another point I missed out in the session is the ecological impact breastfeeding is having. It also helps in stop environmental pollution, because but for the production of formulas, a lot of industrial processes are involved. A lot of energy is being spent. A lot of plastic is being wasted, is being disposed. A lot of paper is being disposed. Transportation is required. And upon all this, there are medical costs involved when a baby gets sick or a mother gets sick. There is a hospital or health expenses involved. So breastfeeding is a zero wastage, zero energy, zero carbon natural resource, and is a sustainable natural resource. During a crisis, when you don't have access for any other food or any or even water, you can still rely on breast milk. So by initiating breast milk, we are helping the environment as well. And as health workers, it is our duty to stay up to date and have updated knowledge regarding breastfeeding.
I have one question, whether I can ask.
Please.
Nowadays, the mothers are working, so they may not able to get more up to 6 months. They may not get time leave. So in such cases, what you can do? Your answer I'd like to hear.
We had already discussed it in our slides. There are government schemes where government has made it mandatory for a mother to be availed 26 weeks of leave, maternity leave for breastfeeding. And this can be availed for up to 2 kids. And after that, I think it is reduced to 12 weeks or so. And for companies with employees more than 50 or with women employees more than 30, the companies are asked to mandatorily required to provide crochet facilities within 500 meters of the company, of the organization, and give mandatory breaks to mothers at least 4 times a day so that they can go visit the baby and breastfeed. Or breaks can be availed for pumping the milk, and pumping and storing the milk. Refrigeration facilities has also to be provided, and proper guidance should be given to the mothers regarding pumping as well. Pumping is not always an easy process. It requires a lot of effort, time, and persistence from the mother, and this is a period when she needs a lot of support.
Thank you very much. Very good.
Thank you, Doctor.
So we are having enough more time. So the right environment is the need of the hour. So in a world now, children is a very rare person in a family, in a big family where a lot of persons, elders are there. And when a mother, aspiring mother, when starting to feed, a lot of interferences will be there. And with homeopathic intervention, we can solve a lot of problems also. For the timid mother, for the angry mother, for the sensitive mother, for the painful, very hypersensitive mother. Every person we can select medicines according to individualization, and we can help the mother also, isn't it, doctor?
Yes, doctor. There was a time, maybe one generation back, there was a time where there were a lot of ladies in a house. There were a lot of babies, children in a house. Nobody needs to teach anyone how to raise a child. So, right when a child is born, she grows up in an environment where she can see babies grow up, where she can see mothers raise babies, children. So, they just grow up, they just grow up to know what to do when they are mothers, and there are always people to guide them. Whenever there is a challenge, whenever there is an issue, there are experienced people to teach them what to do or how to solve the issues. But currently, that's not the scenario, especially when you're away from from your hometown, outside India or outside Kerala. It is a nuclear family where only mother and father, they need to take care of the child, and they have really no idea what to do, how to raise a child, what to do when a baby is crying. Why is the baby crying? What is the actual reason? Is it hungry? Is it in pain? Is it in some kind of distress? Is it sleepy? So mother and father, they have no experience, no idea what to do. And this is the condition where healthcare providers has to come into the picture and start supporting right from during the pregnancy. This education, this awareness has to be given to the whole family. If it is mother and father, just them, fine. Or to the whole family, it has to be provided that challenges can come. There are physical challenges, emotional challenges, social challenges. So challenges can come, but the confidence has to be instilled that a mother has all the power within her to overcome these challenges and raise a child properly.
And another thing I noticed is introducing this formula feed. If the mother is unable to lactate initially and introducing this formula feed initially, the child will be refused. The child won't be able to again feed the mother's milk, because after the mother is able to lactate, the child will be reluctant to feed. On that occasions, will Silesia benefit? Because the formula feed always will be much tastier. The company, the markets always know how to manipulate even the taste bud of the child. And how you feel on that?
Of course, there can be challenges because initially, when you initially offer breast milk to the child, it is easy for the child to adapt to that situation. But when formula feed bottle milk is introduced, that is always an easier option for the baby. As I said, it is a mechanical process. Baby has control over the process. Whenever it latches, it is ensured that milk will come. Whereas breast milk is a more tedious process for the baby. Suckling has to be proper, the latch has to be proper, and it takes a lot of energy, lot more energy than the bottle milk, where gravity plays a major role. So there can be challenges, but with persistent effort and of course with the help of our medicines like Silesia, calcarea carb, we can overcome that challenge. And of course, the emotional and psychological support for the mother should be ensured.
Okay, doctor. And the other thing is, when a child is being panic, or the child will be sometimes will be in discomfort, or the child need to listen the heart rate to the mother, and when the child is always crying, sometimes the child won't be hungry. It need only the mother's presence, or to need to lie over the chest of the mother on the left side itself. Mother need to carry the child, means to attach the child to the chest of the mother. And that thing also, I think in Ken's lectures, doctor mentioned about that. Never to give mother's milk within 1.5 hours interval. Never get in a panic and overdo that and make the child tummy in a fuss. It will get indigestion. The child will get indigestion on that type of thing. Ken noticed and was mentioning in the footnote of Macabre or something like that, I think. So the presence, the cuddling, the caring, caressing, everything of the mother is needed for the child on that period also.
Of course, that is an interesting point that you brought up, doctor. Of course, the mother and child were one unit before delivery, and suddenly delivery is happening, and they are split into two units. So the baby and mother, both side, they seek the touch, the skin to skin contact, and it is a great emotional support for them. And especially when the baby is weak and fragile and in a vulnerable situation, baby always seeks for this touch or presence of the baby, presence of the mother. And it is a great emotional relief for the mother as well. And it is advised that a baby is made to sleep with the mother. Uh, of course, there is a hazard if the mother is encouraged to breastfeed while sleeping. Mother has to be careful not to doze off so that the baby is not getting suffocated or asphyxiated. That is the only criteria. Uh, Maximum skin to skin contact and maximum bonding with the mother has to happen during the initial periods.
Thank you, Doctor. And it's time to conclude, and I welcome Dr. Dhanesh for the concluding remarks.
Thank you, Dr. Bindiraj, and excellent, and congratulations, Dr. Dhanalakshmi, for such a wonderful session. And you really rocked the floor with your knowledge, and the presentation was so brilliant that everybody can just simply sit and watch what just like a professor giving a lecture to the college students. So calm and so everything was fine. The slides were really exemplary, brilliant also. And what I want to say that this is one of the problems that faced by the community nowadays is that most of the young generation youth are suffering from this problem because they have no time to feed the baby because they are under threshold of night duty and everything, and the time itself is changing, and most of them are sitting in front of laptop and has to work together even during the time. That's the reason why our government has given 6 months leave to nowadays. In the early part, it was just 22 months. I still remember everybody, even my mother told me that I just had only 2 months breastfeeding because she has only 58 days of breastfeeding time. That's the reason. She has to go to Palakkad and work there. And I was kept into, I was taken to my uncle's home where the auntie has a 6 month um, a 6 month old baby. And what happened was that I used to take her breast milk, and her baby used to suck her hand. So this is what happened with some people. But still, there is no one but no more complaints for any myself or her, because I was so beautifully cared by the auntie. So there are circumstances where you are forced to take such decision, and but nowadays things are entirely different. Already we have 6 months or 6 months of government uh, leave for them for feeding, and that's it. And the food habit also very important, as you have mentioned here, but I'm not mentioning about all those things because time is already over. Okay, thank you, Doctor. Hope you can come up with some more presentation in the future.
Thank you, Dr. Danish and IFPH for this platform. And thank you for realizing the importance of this topic and giving me another chance to present in English.
Yes, Dr. Rambaresh sir, you can say the auto thanks.
Thank you.
He is also
Thank you, Dr. Dhanalakshmi. Thank you. And congratulations, Dr. Dhanalakshmi. Very nice. A great session. And breathing of milk. Lot of medicine. There's a lot of medicine breathing of milk. Basic medicine, breathing on milk, supporting mother and child. Thanks. Thank you.
Thank you, Dr. Dhanalakshmi. Thank you. Thank you.
Thank you, Doctor.
Yes. There is an announcement as usual. And as you all know that we are celebrating the 5th anniversary of IFBH on the 28th of September. And we are requesting all of you to register for the same. It is just 3,000 rupees per person. As you know, it is being conducted at the Taj Vivant at Cochin. It's a 5-star hotel, so we have to pay a little more there. That's the reason why we have to fix a rate of 3,000. So please register for the session. And if those who are not able to come over to Kochi, may please give your contribution to IFBH. We have shared the QR code as well as the account details on all our groups, and kindly check it. And if any help you needed, we will. You can contact me, either Dr. Binduraj, Dr. myself, or any of the IFBH official persons. Thank you all.